Hello, this is Steve Leon, Physician Assistant, the Medcare Clinical Consultant for WartPeel. And today I'll be discussing using WartPeel to treat seborrheic keratoses. WartPeel is a convenient and effective way to treat seborrheic keratoses. If you want to read our article that was published in Practical Dermatology in 2019 on this subject, you'll see it on the right-hand side. Now, if a person just has a few large seborrheic keratoses, it's still usually best to treat them by conventional methods like hyfurcation or freezing. SK treatment becomes more challenging when you have multiple small SKs in sensitive areas like the face and neck. Unless the patient has a very high pain tolerance, hyfurcation is not an option. Laser treatments can be painful and may also be out of the patient's price range. With WartPeel, you can treat those numerous small SKs on the face and neck, and the patient can treat them at their own pace with very little pain. It's also good for treating stucco keratoses on the legs, which are also small and numerous. WartPeel is not a good fit for patients looking to get rid of dozens of large SKs on their trunk, for example. Those patients it's still better to use other treatment methods. There are a lot of advantages for using WartPeel to treat SKs. First of all, the treatment time is very short, from 3 to 7 days. 3 days, you're talking about the pinpoint SKs on the neck, or maybe very small stucco keratoses on the legs, to 7 days for the larger SKs. Since most providers do use it on face and neck, a person with a good or average pain tolerance can usually ride out the 30 to 60 minutes of stinging without a problem. A few of them do need to use over-the-counter numbing medicine, and I would always mention to patients that the over-the-counter numbing medicine is there and works very well should they need it. Seborrheic keratoses only appear in patients aged 30 and over, so they are just as much of a sign of aging as wrinkles or sun damage. This is something to think about when you're evaluating your cosmetic patients when they ask you, what do I need? So we're always looking for places where Botox would work, or fillers would work, and laser treatments would work. But we should also really look at to see if the person has seborrheic keratoses, because their removal really improves their appearance and does make them look younger. As you'll see, next we'll look at a case and you'll see how WartPeel worked on an actual patient. At $95, WartPeel is less expensive than almost any in-office procedure. This is another advantage of it. Affordability, effectiveness, and the ability to treat their SKs at home at their own pace leads to a lot of satisfied patients and even raving fans. Now, since SKs are genetic, you'll definitely get referrals from other family members who see all of their brothers or sisters or mothers or fathers' SKs being improved, and they want that too. It's a very good practice building tool. Good patient education is crucial for your SK patients to be successful. Now, all these patient education points and tips are going to be on our website too, if you look under the Patient Instructions tab. Whenever you use WartPeel, you always need to stress that it's a glue. And the most important thing with a glue is you let it dry. You need to stress this because people will assume that it's a cream or a solution and will just rub it in, which will cause a lot of irritation and make a very angry patient. Keep in mind, everything I talk about here is incorporated into the patient instruction sheet for seborrheic keratoses, which is on WartPeel.com. So although SKs don't grow nearly as fast as wart, you still want to emphasize to people not to skip days so they're consistent and they get the treatment over with earlier. SKs aren't fast growing. If they skip some days, it's not really going to affect treatment much, but I just mentioned don't skip days so that people feel a sense of urgency and don't lollygag around with it. Use it one day and then use it a couple days later, then use it a few days later. That's not going to produce good results. On the fingers or the bottom of the foot, for example, people only experience stinging when WartPeel reaches the dermis. Skin on the face and the neck are much more sensitive. Most people tolerate it without the need for topical numbing cream, but you always want to mention that topical numbing creams, ointments, and sprays are available if the burning becomes more than what they're willing to tolerate. When a person starts using WartPeel for their SKs, the first thing that happens is this starts to swell, and then it scabs. Sometimes the scabs fall off on their own. I would say most of the time they do. But sometimes they just become really dry, flat, and adherent. And patients keep putting WartPeel on this dry, adherent scab, and nothing happens. So part of the instructions is to have the patients use a damp cloth, especially when they're in the shower or after the shower, to assist in these adherent scabs from coming off should they develop. When to stop is one of the most common questions. This is why a follow-up around the end of the first treatment can be helpful. When the scab falls off or is wiped off, if it's an adherent scab, you can see the red dermis underneath. Red means stop. Once you see that red dermis, it means you're done. I give this example that every patient can relate to, a blister. I tell patients that after a blister is gone, you see the red area underneath. That's the dermis. Your SK only lives in the epidermis, which is the part that blisters off. The red dermis underneath, it can't live in. This is because SKs have no roots. So when you see that red skin, just like a traffic light, it means to stop. After the patient washes off the WartPeel in the morning, they should apply an ointment to assist in healing. You may have your favorites. I like to prescribe a jar of 2.5% hydrocortisone ointment. I feel giving the patient a prescription improves compliance because they see it as a better product than something they can get over the counter, and they're more likely to get it and use it. The cortisone helps to reduce irritation and post-inflammatory hyperpigmentation. Patients should be warned about post-inflammatory hyperpigmentation at the first visit or the follow-up visit, as well as treated with hydroquinone as soon as the area is epithelialized if necessary. There's nothing worse than a patient getting rid of their SKs and having great results, but coming back and telling you that the spots are still there, or worse, treating the PIH areas with more WartPeel, which creates even more PIH. So this is something that you need to educate people about. Many of the patients you'll treat have extensive SKs, and you don't want them treating them all at once. You want them treating a small area. You want to have a follow-up and see how that treatment's going. And then once they get some experience with it, they can start treating more SKs and have less follow-ups. This patient is very happy because most of her DPNs are gone. She did it with 2 tubes of WartPeel, so it cost her under $200. She did it area by area over a 2-month period, taking a few breaks in between. You can still see some dyspigmentation, which, as you know, will resolve over time. This patient came to me with a chief complaint, which we commonly hear, that she was tired of looking like her mother. Her mother had these, as you can imagine, even worse, because you get more and more of them with age. Here you see the before and after pictures on the left side of the face. The highlighted area is where I performed cautery about a month ago on a large plaque of DPNs, and now there's significant hyperpigmentation. That procedure was too painful for her, and she was looking for a different option. Here you see the before and after results on the left side, and they're even more dramatic than on the right side. You can see how without the SKs she looks younger and has a much cleaner appearance. The next upcoming slide series will show the during pictures of how her treatment went on the right side. Here's a baseline of her picture. She has extensive, mostly small DPNs all over the face, and there are a few areas where they coalesce to form small plaques. The patient was educated about the number of days to use the WartPeel, about the numbing spray, the stinging, and of course I emphasize that it's a glue and to let it dry. I also mentioned the post-inflammatory hyperpigmentation as well. So let's see what happened when she came back after using it for the first time. When this patient came back for her first visit, this is what I saw. The patient told me that her mother put on the medication, and she admitted that her mother may not have the best eyesight. This was in my early days of using WartPeel, and my first thought was I had scarred this woman for life. but no scarring actually happened. There was just more post-inflammatory hyperpigmentation than if she would have applied it properly. Remember that scarring with WartPeel is very, very rare, and that's because the adhesive base sticks very well to the epidermis, but once it reaches the dermis where scarring can occur, there's too much water for it to stick well. Plus, once the WartPeel reaches the dermis, it starts to sting a lot, and most people naturally discontinue its use. The challenge with this patient is that the DPNs were so numerous and so small, she needed to precisely apply them. I educated the patient to use the very tip of the applicator that comes with WartPeel, to hold it at a 90-degree angle to each individual DPN and dot it precisely on. So let's see what happens next. Believe it or not, this is just 6 days later. The area has epithelialized well, and I prescribed the patient hydrocortisone 2.5% ointment in hopes of having the area heal faster and also diminishing the PIH, which is sure to come. 5 weeks later, you see that there is indeed PIH, but also many of the DPNs are gone. Next, she wanted to treat areas around her temple and eyes. At this point, she has not used any numbing cream and was tolerating it well. I advised her that the over-the-counter numbing cream may help her in these more sensitive areas, but ultimately she wound up not using it, saying yes, it did hurt more, but she was still able to tolerate it. I advised her not to use it on her eyelids. I mostly worry about accidental application to the eye itself, but one of the nice things about working with an adhesive gel is that as long as it dries, there's no danger of it getting wiped into the eye. Here you see what normal pinpoint application of WartPeel looks like for SKs. Now this picture, which was the after picture you saw earlier, was taken about 4 months after the initial application. You see that the post-inflammatory hyperpigmentation is fading. She's been using hydroquinone 4% for about a month now. She's very satisfied with the results, and her sisters who have the same condition have definitely noticed and she said are a little jealous of her. Now with the previous photo, I know some of you were thinking that, wow, that's a lot of PIH, but a lot of lesions were treated. And the question is, that's a lot of PIH compared to what other treatment? In this picture, you see the side of her face that's circled. That's where I did the hyfurcation a month before starting the WartPeel treatment. It's not a DPN. I numbed this area and very carefully did a C&D. Now let's take a look at that area about 4 months later. So here is the after picture on her left side. She looks great because most of the DPNs are gone. There's still some post-inflammatory hyperpigmentation, but if you look by her left sideburn, she still has post-inflammatory hyperpigmentation, but the worst area by far is by her left sideburn. That's where I did the hyfurcation a month before I started the WartPeel. So hyfurcation led to much worse PIH than the WartPeel treatment did, and you can see it all in this picture. That concludes our presentation. At Medcara, we believe in standing behind our product and supporting our prescribers to get the best possible results from WartPeel. That's why I'm available to answer questions, to go over cases by phone, text, or email, and I'll respond the same day or the next business day. I can also do a virtual presentation for your office or professional organization. And don't forget about all the educational resources at WartPeel.com. I'm Steve Leon, Physician Assistant, Clinical Consultant for Medcara and WartPeel. Thank you for listening.